Live well now with Dr. Lauren.
Hello everyone, it's Dr. Lauren Powell here with another episode of Live Well Now, where I give you easy to understand health empowering education, tips, and strategies to help you live better now, because we don't have time. We don't have time to be sick. We don't have time to not be feeling our best. And so my hope is that by giving you this educational information that's so simple, that's so easy to digest, that you can live better now, that you can help your family and your friends and your community all live better now. So today I wanted to talk about a topic super simple, super easy, but maybe complex for some of us or overwhelming. And that's hypertension or high blood pressure. I wanted to talk about it because it's something that affects a lot of people. It's something that I think there's a lot of misunderstanding about. And so I wanted to talk to you about it today, make it simple, give you some background information, help you understand your numbers, and give you some tips and strategies on how you can make that blood pressure better. Okay, so first, I want to talk about the prevalence. I always like to paint this picture because sometimes we think that this doesn't affect many people or this won't affect me. But listen, and this is data from the CDC from 2021 to 2023. My guess is these numbers are slightly higher. But the prevalence of adult hypertension, so adult elevated blood pressure, was 47.7%. So that's almost 50%. And just so we're clear, the latest guidelines show high blood pressure, or we're calling it, there's pre-hypertension, stage 1 and stage 2. You're going to see a chart here. And this shows you, so we like you want less than 120/80. I like people less than 120/80. My goal is not to get you, my goal is for you to be less than 120/80 as a normal blood pressure. Sometimes patients only know the top number and they don't know the bottom number. Both numbers are important. Systolic tells me the pressure when your heart contracts. Diastolic tells me that pressure when your heart relaxes. So both numbers are important. So what is hypertension? What is high blood pressure? So first of all, blood pressure is the pressure that forces blood through our arteries away from our heart and to the rest of our organs, right? Our organs need oxygen, they need nutrients, and all that is delivered in blood. And so there should be a normal pressure at which that happens. But if that pressure becomes higher, for reasons that we're going to talk about later, what happens is your blood vessels become thick. And I want you to look at this diagram. Thick, not in a sense of strong thick, but thick in a sense of narrowing. And so you can imagine, if you look at this picture, pretend that this is an artery delivering blood to your kidney. If that lumen, that's the opening of the blood vessel, if that gets smaller and smaller, there's less blood that's traveling through there. And there can become a point where it becomes completely occluded. And if that happens, then there's no blood flow. There's no blood flow that's going to that organ. So thicker, less blood flow, less nutrients, less oxygen. So again, we're pretending that this is an artery going to a kidney. If I'm getting less blood flow, less oxygen, less nutrients to that kidney is not going to be able to function well. Think about you and your body. If I gave you less water, less food, and I steadily decrease that, you're not going to feel very well. You're not going to be able to have energy. You're not going to be able to have the nutrition and all the vitamins and minerals you need to function. And so that's what we're doing as we're increasing the thickness of that blood vessel due to high blood pressure. We're decreasing the blood flow that then reaches your various organs. So if you look at this picture, you can imagine if you have a decrease in blood flow to all these different organs, a decrease in blood flow to your brain, that's how people get strokes. Decrease in blood flow to your eyes, that's how people get vision loss. To your heart, that's how people get heart attacks. To your kidneys, like we talked about, heart failure. People can have decrease in blood flow to their sexual organs, and that's how men will complain about erectile dysfunction and things like that, and it's because there's less blood flow. Now, 1 in 3 people are not aware that they have hypertension, and that's because obviously you feel a heart attack, you feel blindness, but you may not feel all the damage and things that are being done until you have an event. We call those, when somebody has a stroke or a heart, we call those events. Those are things that are going to bring you to the hospital. But oftentimes things are happening before these major events because we don't want you to have an event. We don't want you to have the stroke. We don't want you to have the heart attack. And so we're trying to catch these things before someone has an event that brings them to the hospital and we discover their blood pressure is high. But what about 3, 5, 7, 10 years ago? Was their blood pressure high? Was there some intervention that we could have done back then to prevent this event that happened right now? So when 1 in 3 people don't know they have hypertension, that's because they don't feel super bad. People can have high blood pressure and feel okay. And that's partly because your body's really smart. So if your body is used to operating at a blood pressure of 178 over 100, it may not feel it. Like it may just be like, oh, I mean, I'm not feeling the best, but I mean, I'm able to go to work, take care of my family, cook. I'm able to do these things and I'm able to do it. And so I quote unquote feel okay. And so these people may not seek medical intervention. They may not be going to the doctors regularly. So we don't know their blood pressure is high. They don't know their blood pressure is high. And then they don't feel overly bad. But just because you don't feel bad doesn't mean bad stuff is not happening. Sometimes people do experience symptoms of their high blood pressure. Sometimes patients will have headaches. They'll say, I'm seeing spots or visual stuff. Sometimes they'll just report feeling off. And of course, you can have chest discomfort. You can feel lightheaded. Oftentimes, patients don't know they felt bad until they start feeling good. Meaning they have high blood pressure. They come and I say, hey, you have high blood pressure. Let's treat it. We start to lower it. And as we lower it, they may actually feel a little bit weird because their body's like, wow, I'm used to functioning at a high number, like 178 over 100. You're bringing me down lower and now I'm feeling kind of off. I ask patients to just trust me through that. And then as their body settles at this now normal blood pressure, they actually feel better. They'll say, doc, I didn't even know that I was having this baseline headache all the time. I didn't even know that like my vision just didn't really seem sharp. I didn't really know that I was just feeling tired all the time until now I don't. So I say sometimes you don't know you can feel good until you feel good. So like we said, high blood pressure can lead to heart disease, stroke. It can lead to vascular dementia. It can affect parts of your brain that affect memory and your ability to remember things. Heart failure, blindness, sexual dysfunction. Heart disease is a silent killer. It's a silent killer. Again, sometimes people feel nothing. And what happens is, I tell my patients, we don't want to wait till you feel bad to treat something. Because what happens is you're feeling bad, maybe, oh my gosh, I'm in kidney failure. Oh my gosh, I'm blind. Oh my gosh, I had a stroke and I can't use my right arm. Or oh my goodness, I had a heart attack. Like if you wait till you feel bad, that's like a whole different situation. If you've had an event due to your high blood pressure, now it's not just about like, okay, let's making sure your blood pressure is under control, but now we've got all these other things that we have to worry about now because you've had an event. If you've had a stroke, that could lead to permanent damage. The reason why we like people to get to the hospital as soon as there's the earliest signs that someone could be having a stroke is because we want to, what we call reperfuse, we want to start that blood flow again. And if we can intervene early, we are going to try to do that. But sometimes it doesn't happen. Sometimes people have strokes and it's at night. Sometimes people are alone and they don't know. Sometimes people, like my dad, when he had his stroke, he thought he was just tired. He thought the reason he was having issues with his speech is because he was just tired. And so sometimes people don't always recognize their symptoms of a stroke. And so we cannot aggressively treat them in that moment and they end up having some permanent deficits, which is what we do not want. So why does blood pressure happen? Like, why does it happen? It can happen because of stress. I've seen people have such high levels of stress. It doesn't matter what medications I throw at them. There's just so much stress in their life that it's very difficult to control their blood pressure. Sometimes people are not sleeping well. That's why it's important for us to know that top number and that bottom number of someone's blood pressure, because I notice sometimes that bottom number will be a little bit resistant or hard to come down. And oftentimes I find that that's related to sleep. Either somebody has sleep apnea where they're snoring or having periods of not breathing. They're just having sleep disturbance where their sleep is not restful. They may be waking up throughout the night. And so then we really need to address that underlying cause of their hypertension, which is their sleep. And then excessive salt and processed food. Sometimes people are really sensitive to salt, meaning they eat some salt and their blood pressure spikes. That is one category of people. That's a smaller category. Overwhelmingly, people are getting too much salt from the processed food. It's from the food that you get through the drive-thru. It's the food that you get that's already prepackaged. It's not very often that people are getting too much salt from the food that they cook in their home. It's possible. Now it's possible if you're loading up on all the seasonings and all the blends, you can get too much salt in your diet at home. But what I found is that most of the time, when my patients are having high blood pressure related to their food, it's not because of the food they're eating in their home. It's because of the food that they're eating elsewhere where they have no control of the salt that's in it. They have no control of the sugar, the additives, and all the stuff that's going in to make that food that's not being made in a homemade kitchen. It's being made at a fast food restaurant. There's also medications that can cause high blood pressure. So whenever someone's blood pressure is high, I want to know, have you recently been on any NSAIDs? That would be like your Motrin, your Advil, your ibuprofen. Are you on any decongestants? Sometimes people have had colds, they have sinus infections, so they've been taking medication for that. Some stimulants, medications that people may take for attention and focus. Sometimes people are not affected by that. Some people are really affected by that. So we need to know what medication somebody's on. Some weight loss medications can cause stimulation as well, and that can cause a rise in blood pressure. There's some hormone supplementations that cause high blood pressure. I remember when my mom first started taking hormones, she had spikes in her blood pressure, someone who always had incredibly low blood pressure. So it was directly related to the hormones that she was taking. Antacids, some of those can increase your blood pressure. And then there's some herbal supplements as well that I've noticed, that I've seen, that will increase patients' blood pressure. So I always ask my patients, are you taking any supplements? Because sometimes it's not like the active ingredient in the supplement, it's something else that's in the blend that I don't even know what that is, that can cause an increase in blood pressure. So anytime you go to the doctor, please bring your everything that you're taking to your doctor's office. Sometimes we can make sense of it. Sometimes it's really hard, but sometimes we can at least look it up and see if there might be anything that might be contributing to your blood pressure. Some people have a genetic predisposition. And that's just, we have to be honest about it. We can do all the things. I've had patients that are vegan, that run marathons, that have a very healthy BMI, and their blood pressure is still very, very high. So we have to look at some of those other causes. If there's a genetic component, if there's a kidney disease, if there's other things going on that may be contributing to that patient's high blood pressure. So what kind of things can we do to improve our blood pressure? So these are the tools that I want to give you. These are the things that I want to empower you with. Again, I think it's really important that we cook our food from home. Even if you didn't completely radically change what you ate, say you're someone that eats a burger twice a week, say you're someone that eats fried chicken sandwiches, I'm not going to say the restaurant, say you eat those regularly, but you just start making that at home. You just start getting a chicken breast, cooking it at home, battering at home, cooking it at home. Even you just eating the same food but cooking it at home, I know you're going to use less salt than they use at these places, because they're putting other additives and things in their food that are making it so yummy and so addictive, that are also causing rises in your blood pressure. But if you can eat lots of fruits and vegetables, whole grains, your wheat bread, your complex carbs, your sweet potatoes, your brown rice, your quinoa, nuts, seeds, beans. I like to use a lot of fresh herbs and garlic and cilantro and parsley and rosemary. These fresh herbs that are a great way to add flavor without adding salt. Look at like anything that comes in a jar or a box. Sometimes there's a lot of salt in them. So you can look at the ingredients, and ingredients are listed they're listed in order from like highest amount to lowest amount. So if the first ingredient is salt in that, whatever you're eating, you know that there's a lot of salt in that. So be mindful of that. Again, I want you to incorporate fresh fruits, vegetables, your lean proteins. I want you to sleep well. And what does that mean? That means you fall asleep well. It doesn't take you hours to fall asleep. That means you're able to stay asleep. You're not waking up throughout the night, because that's not good for your blood pressure. And when you wake up in the morning, you should feel refreshed. You should feel like you just slept. You shouldn't feel like you need to get back into bed. You should feel awake and alert and ready to start your day. If you don't feel those things, you need to talk to your doctor about your sleep, because your sleep is not well. There's something else I was going to say about sleep. Maybe it'll come to me. But you need to make sure that you're sleeping well. And you have to, I think I wanted to mention quantity of sleep. Some people are just not allowing themselves enough time to sleep. I ask my patients, how many hours did you sleep? They'll say 4, 5, 6 hours. I'm like, this is just not enough. You're not giving yourself enough time to sleep. But I know it's because people are really busy. They're staying up late. They're working. Sometimes people have kids, and so they're putting their kids to sleep. And then they're kind of like getting into like taking care of themselves or catching up on stuff from work from the day. And then they're waking up early. So you got to figure out a way to get 7 to 8 hours. I know I feel significantly better and different when I've allowed myself to consistently get that many hours of sleep. And I'm actually more productive in the daytime because I've slept well. My brain is just functioning better. So then the next question you may be asking, Doc, is do I need to take medication? Do I need to take medication for my blood pressure? And I'm going to say, I tend to be very aggressive about blood pressure. And that's because I don't want you to have an event. I don't want something bad to happen. The lifestyle stuff, helps. It definitely helps. And when you've been diagnosed with hypertension, any stage, it's a non-negotiable. Like, you have to do the lifestyle stuff. The lifestyle stuff though can take some time. So while we're working on lowering your blood pressure, we may need to incorporate some medication so that we protect your kidneys, so we protect your eyes, so we protect your heart, and so that we protect your brain. Another thing that's really important is that you monitor your blood pressure at home. I have patients where they come to my office, their blood pressure is high. I have a young 18-year-old, I see her once a year, and every time she comes, her blood pressure is so high. And she's like, "Doctor, I'm sorry, you just make me so nervous." But she checks her blood pressure at home, she sends me readings, and I'm confident that her blood pressure is well at home. I see her blood pressure when she goes to the dentist, and it is well. So I know some people have what's called white coat hypertension, even though most of us don't wear white coats. It's just this anxious feeling we get when we come to the doctors. And so it is more important to me what your blood pressure is at home, what it is on a regular basis, and what it is when you come to see me for 20 minutes every 3 to 4 months, okay? So track your blood pressure at home. Bring your cup to the office so we can compare it, because we want to make sure that it is working well, that it works as good as our manual cup. We use a manual cup in my office, which is the best way to check your blood pressure. I recommend, if you're someone that your blood pressure has been kind of giving you some issues, that you check it 2 to 3 times a week. The more numbers you have, the more data, it's just helpful when you come to your doctor and they're not having to make a decision based on one blood pressure reading that we have in the office, but you're able to give me data and show me lots of numbers so I can really look and see if there's a trend. I can really remove any outliers and see what does your blood pressure really look out. I'm going to show you this video. I want you to see this is a proper way that I want you to check your blood pressure. Okay, so we're going to start with having our feet flat on the ground. I'm in a nice, relaxed state. I'm going to take my blood pressure on my left side. You're going to have different size cups, so you want to pick a cup that is appropriate. One that is too small or one that is too large is not going to give you an accurate reading. So I'm going to grab the smallest cup and use that. I'm going to make sure the placement is above my elbow. It's not going to go below your forearm. It's going to go on your upper arm, right above your elbow. Make sure it's on nice and tight. Again, feet are flat on the ground. I'm letting it take my blood pressure. I'm relaxed. I'm calm the entire time. I'm letting it completely deflate before I take any look at what the value is. You can see the display is nice, it's bright, it's easy to read, it's easy to interpret, and it's easy to keep track of. All right, you guys, I hope that was helpful. I want to make sure that I list some of the foods that I want you guys to be thinking about with your food. I mentioned them briefly, but I want to go over them again. Lots of fresh fruits and vegetables, whole grains, lean proteins. We're trying not to deep fry things, right? Because that's adding extra salt. Nuts, seeds, legumes are going to be great. Look out for your seasonings. I have a seasoning. I don't have it out now, but I have a seasoning that's very low salt. And so with it, you should not have to add anything because it has everything that you need to make a delicious meal. It has salt already in it, so you don't need to add anything else. Right, so the nuts, seeds, legumes, and then in addition, things like garlic, beets. So actually just throws a clove of garlic in his smoothie sometimes in the morning. I think that's kind of gross. You can simply just cook with fresh garlic. Beets, I love to blend beets like with citrus fruits. I find that that's very satisfying and tasty. Also, of course, you can eat them raw and great. It's great in a salad. Celery is really great for blood pressure. Green tea and cinnamon are all great foods to incorporate and cook with that can improve your blood pressure. So in conclusion, I hope this was really helpful for you. I hope this gives you some insight into what the numbers mean, why it matters, things that you can be doing, tools in your tool belt help you better understand why blood pressure can be so dangerous, why it's so important to control it, and things that you can do to help you and your family members and people you love and know feel better. So until later, thanks for watching. We'll see you on the next episode. This is Dr. Lauren Powell, and I'm inviting you to live well now.